that's really driving us and our product. As you know already, it reduces symptoms by 5% of stuff like rashes, nausea, and it doesn't cause suicidal depression like some other generics have been shown to cause. I really care about people, and I remember we had a discussion saying like that's what got you into becoming a doctor in the first place. And how's Jimmy, your son?
Oh, he's doing well. He's doing well, and I very much appreciate like the free T-balls and stuff you give with the samples. I mean, it's really the personal touches. I really appreciate that. But I know that drug companies, I was just reading an article on this in the New England Journal of Medicine, and that they spend over $24 billion on marketing to doctors, and only 5% on marketing on TV. And you see those ads all the time, so I can't even imagine how much you spend on samples.
A lot of what we do is just raising awareness, and I can't speak for other people because there's some disreputable people out there, but for me it's about kids, and our drug is mostly aimed at a younger audience. Well, let's say, I hate to do this, but I mean, what if my kids had this issue? I would want the best. I don't want them being depressed, having these rashes. And what about your kid? What if we're Jimmy? Anyway, I appreciate meeting you. Before I go, I don't know if you happen to be interested in Prince at all.
I mean, I don't want to accept a ticket. Oh, I know that he's coming to Boston.
Actually, an interesting thing is we got free tickets. Everyone in the office. I have to work that weekend. I mean, I just have to meet with some other people. I can't. If you know of anyone who would use 2 tickets or if anything, just let me know. If you want, just leave them here so you don't feel pressured or anything. But they're no good for me. So, I don't know if you're interested.
I know that taking these tickets will not cause me to prescribe Solidin more.
I know that by giving her those tickets, she'll be subtly feel like she has to pay me back, eventually by prescribing my drug.
But the most important thing that you should gain from this medical ethics seminar is the tricky relationship between doctors and drug companies. You are very lucky to be students at Lysae Medical School because 99% of the medical schools in the country do not have a program directed specifically to investigating the relationships between the doctors and drug companies and educating the students, the medical students, about this relationship. In my experience, the most interesting aspect of the drug company-doctor relationship was going to my first continuing medical education seminar to keep my license. And the location of it was in like an exotic, beachy resort area. And I was just confused why there were drug reps there and how some of the slides, some of the guest speakers were sponsored by drug companies, and these speakers were also doctors, and they were promoting the drug, and I didn't think that drug reps would be doctors, and that was the most surprising thing for me. And I just want to warn you that in your future, you'll just need to be very careful about excluding what you think is fuzzy reasoning and things that are not backed by significant research, and then promoting those drugs to your patients.
Professor?
Yes?
Do you ever find yourself being tempted by these drug reps? Do you ever think that these gifts that they give you have ever influenced your prescribing practices?
I don't believe so. It's been challenging because you want to give out free prescriptions because if you believe in their efficacy. Sometimes it's difficult for me to know what the efficacy is of the drug, as the drug rep is often a doctor that tells you a good off-label usage of it. And if you see a patient that's suffering, you think, well, why shouldn't I try it? It's just difficult. You really need to look at the facts in a case-by-case situation.
Yeah, it's just hard for me to see when I'm a doctor this happening to me. No one really tells me what to do. No one really manipulates me. So I can't see how, a pen could sway my decision on prescribing the drug.
tomorrow night, LB and David Pharmaceuticals is sponsoring a free
I
dinner.
already told you, man. I have an exam tomorrow. I have studying to do. I don't really have time for that.
But it's free. It's the most expensive.
Hey,
Joe, how you been? How's your girl? How's your girl?
We come up on 3 months, and thanks for the BlackBerry. Oh my goodness.
Yeah, very nice. You text her a lot on that?
I texted during class when Professor Berger's like, ethics, you guys should watch out for them, or...
You realize that stuff's important. What you saying in class applies right now. That's blood money, man.
Did you take a pen?
Yeah, I took a pen.
So I took a pen, you took a... Where are your ethics?
This pen right here isn't going to influence me.
So yes, I know you're coming tomorrow night, right? We're having it's LB and David. We're at Pharmaceuticals. We're sponsoring a free dinner, most exclusive place in town. Take your girl. It'll be great.
I really want to go, but I don't have anything nice to wear.
You like Armani? You like this? I can get you one. I can get you a really big discount. It's gonna be like $10 for the thing.
Really?
Yeah. I mean, it's
But
great.
the dinner's tomorrow night. That's kind of...
Come on, you have to be there. Everyone's gonna be there. I might even get some celebrity to come. I mean, it's that exclusive. You know?
Really?
Yeah.
Really have an after party, maybe pre-party I can come to? Get some tickets.
Yeah, sure. Carol, by the way, I know you're busy with books. Would you like you need books to study? Would you like a discount for a local bookstore?
Oh, well, no.
Here,
Not take
take one for your friend.
I don't pay attention to class anyway.
So one for your friend, all right?
I can't believe you're listening to this guy. He's only trying to go after us right now because we're young med school students. He's trying to make an impression on us. And after that, he's going to be your slave, man. You're going to be a slave, man.
I'm going to be his slave.
Yeah.
I'm going to be Dr. Brooker's slave. We're going to be their slaves for the next 6 years, working 80, 100 hours in the ER, doing scut work for them. He's just trying to help me out. He's looking out for my best interest. My 3 months to come with my girlfriend, she wants something special.
But really, so you're going to let what he says influence what you're going to do?
It's not influencing what I'm going to do. It's just, he's helping me out now.
I don't know, man. I really can't do this. I know you wanted me to go to this dinner with you, but I don't like that. I can't do it.
Come on, just go with me. All right? It's not binding. Did he say we have to prescribe drugs when we become residents or when we have our own practices?
No, but I mean, I don't feel good about it.
Why not? I'll do it. We came in here together, right? We came to med school together. We're going to help people together. We're going to
Right.
do free books
This is
together,
about
free
it.
dinners together, okay? All right,
Okay.
just
I
hang
mean-
on to it.
I guess you're right. See you
All right.
tomorrow.
Let's go.